Is that the amendment be agreed to. The member for Goldstone.
Thank you, Deputy Speaker, and it's a great privilege to be able to get up and speak on the matter and the bill before the House, because this bill, Deputy Speaker, speaks to the very clear success of a Morrison government. Because what this bill, even in its modesty, seeks to do is make sure that no matter who you are, no matter where you live, no matter the challenges you face, that you will be guaranteed a supply of medicines on the pharmaceutical benefit scheme in the community that you live, and with accessibility and affordability. And that's at the heart of what this bill tries to achieve. It's only a modest cost of about $2.8 million a year, but enables and makes sure that the supply of medicines on the PBS to people, particularly in rural and regional communities, get the dividend of this government's strong economic management. Because we know full well that we have situations where pharmacies go into administration and there are challenges and problems that are faced directly by local communities in their capacity to be able to access medicines because of the challenges faced by an individual pharmacist. And what this parliament is here to say today is, regardless of who you are and where you live, that you will not be left in doubt. You will not be left in the lurch. That we understand that across this great continent, no matter who you are, that you have a basic expectation towards receiving basic medical care, whether it's your doctor, whether it's in your hospital, whether it's emergency care, and of course access to life-saving medicines. And this bill is particularly important because more and more Australians, of course, are living with chronic conditions, the consequences of an ageing population and the need for additional support and assistance. That's what this bill seeks to achieve. It's a relatively trivial in the grand scheme of things in terms of administration, but will have a real impact in terms of people's lives. The changes will bring applications by pharmacists in line with the Australian government charging framework, and the changes help to ensure access to PBS medicines can continue uninterrupted where a pharmacy is affected by bankruptcy or external administration. And of course, as I've outlined already, where does this happen? Particularly where there are only a single pharmacy within a community, and therefore they need assistance. And this is against the backdrop of the entire Morrison government's health agenda, its economic agenda as well. Because one of the things that those people in the opposition benches don't understand is that if you can't afford to pay for medicines, you can't afford to deliver them to the Australian people. And with more conditions receiving life-changing or improving or saving medicinal support, the government faces an ever-looming and greater challenge around financing the cost of the nation's health bill. And it's only when you have a clear-eyed, controlled management of our nation's finances that you're in a position to be able to support these type of legislation to make sure that there is guaranteed supply through to consumers at the end of the supply chain. And so this is why it's a fulfilment of the Morrison government's agenda for Australians, to make sure that nobody is left behind, and that through the PBS, patients can access medicines that in some cases will cost tens or even hundreds of thousands of dollars per year for a maximum of only $6.50 per script for concession card holders, or a maximum of $40.30 for non-concessional patients. Patients will then, of course, receive free or reduced cost scripts once they reach their safety net. And of course, it sits against the backdrop of nearly 186 million different scripts that are signed across the country to be able to access important health and medical care. We're averaging, as a consequence of this government's strong economic management, 31 new or amended listings per month, or approximately one per day. And you compare that with the legacy of the last Labor government. And we don't draw this distinction, Deputy Speaker, for trite political purposes or partisan purposes. We draw this distinction because it has real human impacts on real people's lives, where they stopped listing new medications on the pharmaceutical benefit scheme because their irresponsible economic management meant that Australia couldn't afford to. And I can't think of anything worse than when a country has been so mismanaged, as it has been previously under Labor governments, that you turn around to those that are sick, those that are suffering, those that are confronting life challenges and, of course, their own mortality, and saying, we stuffed up, so therefore you can't get care. And that's the eternal shame that will always hang over those who sit on the opposition benches. Well, they get up and carp and complain because whatever it is we do, it's never enough. Like when we deliver tax cuts, and even though they went to the last election promising $387 billion of new taxes, apparently ours aren't cutting fast enough. So too with their agenda around health, where they constantly talk about how they want more spending and more costs. They can never map out a plan about how they're going to pay for it. And when they've been in government, and don't just judge what they say, or judge what they have done and will do, they have fallen short and left Australians who are already in difficult times and sometimes their darkest hour in the lurch. And it's about time they stood up and took responsibility for their actions and their conduct. And it's about time the Australian people held them to account, as they did at the last election, for their empty promises and empty hope. This bill sits at the heart of exactly what this government is about. It's a government that's prudent, responsible, because then we're able to deliver the human dividend of making sure that no matter who you are, no matter where you live, and no matter your condition, that this government and this parliament is in the best position to help and aid and assist you, to back you, so that when you're facing tough times, you're not doing it alone, and you're certainly not being told by those in the Labor Party, sorry, we can't help you because we can't help ourselves. And that's why this bill matters. And that's why it's important to enjoy the support of the parliament, despite the virtue signalling amendments that are being put forward by our Labor opposition. Because rather than talking about the fundamentals of what they would do to make sure they guarantee PBS access for millions of Australians, their consistent agenda, no matter what piece of legislation comes into this parliament, has been to drive distraction. We won't let them get away with a deputy speaker because Australians can't afford to let us do so.